Hello everyone, I'm Dr. Shabahat. I'm consultant cardiologist and nowadays working as assistant professor of cardiology. So today we'll be discussing another important topic with you guys. I'll be telling you a brief overview of ECG uh, that usually we advise why we usually advise in patients. So I'll be discussing everything briefly about that, and I hope you will understand that. So first of all, I would like to request you guys that kindly like my channel, subscribe my channel, kind of click on bell icon because you will find various videos in Urdu as well as in English regarding health. So we'll try to discuss various topics, and my purpose of making this YouTube channel is like to educate everyone in terms of health in simple language. Another important thing is we'll be launching a similar website as well in this month, and kindly visit that as well because you'll find latest health related news, various articles, public service awareness messages, and any latest health related campaigns will be the posting over there as well. So about ECG, let's start with it. So what is ECG? ECG is basically electrocardiogram. So how what is that basically? It is basically proof or diagrammatic or graphical presentation of your cardiac electrical activity on a graphic paper via ECG machine, right? So this is a very basic test, and in which patient a doctor advise that test. There are various conditions. First of all, the most important thing is if you are having a sudden chest pain or heaviness or squeezing of your chest. So and you go to nearest emergency, doctor will straight away prescribe or advise you to go with ECG in ER, because they have to look either you are going through any acute MI or any major heart attack or ST elevation MI, I must say, or if you are not having or what kind of ECG change is going on, or if you are having previous history of any cardiac disease. So they have to compare, like is there are there any new changes in your ECG or not. Another important indication why we go with ECG, like that is about your heartbeat. If you are having any kind of feeling of any changes in your heartbeat, or are you if you are feeling any palpitations, so obviously doctor have to see, like uh, is there any problem in your cardiac electrical activity, because what things can we look for the in ECG. These are like either is there any bradycardia or low heart rate, is there any tachycardia or increased heart rate, is your rhythm is regular or not, is there any irregularity in your heart rate, and I must say another important thing is, like if you are having any dizziness episodes or any fainting episode, we need to look about are you having any kind of heart blocks, any cardiac any pause in your cardiac activity. uh, Moreover, like these are the major points which we usually look for, like any arrhythmias, any increase in heart rate, any pause, any heart blocks, or most important, uh, never the least, is any MI, or any acute thing which we need to manage timely, because time is the game in any cardiac patient. So another, like if you are not having any acute symptoms, like if you are not having any symptoms in terms of minutes or hours or within 1 or 2 days, like if you are having symptoms in like couple of weeks or months. Still, the basic and start of your cardiac investigation is your ECG, because we have to look for any chronic changes in your ECG, or if you are having any uncontrolled blood pressure, we need to look for that. Like if you are having any kind of hypertrophic ECG changes as well, because after that we will be moving to echocardiography, which is in common language ultrasound of your heart. So I'll be discussing that as well in another video. So these are the basic things, and this is the very best and good investigation, non-invasive, and without any harmful effect. Just like if you are having any allergy due to gel which you put before your ECG leads, that is the only thing. Otherwise, like it's a very simple and accessible, your accessible test, I must say, in terms of your record of your cardiac activity. I hope you will like my video. Kindly like it, share it with your family and friends, and take care. Bye bye.